ECG. The Bennett might say the patient is 75 plus HEPA TIA plus BP normal. ECG shows sinus rhythm with no abnormalities. Next best step is Holter monitor, 24-hour ambulatory ECG monitor to pick up the paroxysmal AF. For example, when the patient goes home and has dinner. After AF is diagnosed with regular ECG or Holter, 2 CT bonds echo as a next best step to visualize the LA neural thrombus. 22 male stab wound to the left chest, JVD and muffled heart sounds plus hypertensions, maybe cardiac tamponade. Bactriad seen in USMLE question, JVD plus muffled heart sound plus hypertension also associated with pulsus paradoxus. Easy. In HOCM, what would you expect the apex beat to be lateralized or in the subxiphoid space? Lateralized will be same for dilated cardiomyopathy also. Apex beat is where you calibrate the point of maximal impulse of the heart during systole. When the LV is enlarged, you will palpate it lower and more lateral. The question can say the point of maximal impulse is in the anterior axillary line or in the 6th intercostal space. It should normally be around the 4th intercostal space, left mid-clavicular line. Apex beat in the subxiphoid space means a long, narrow cardiac silhouette when we get in COPD, where the massive hyperinflated lungs push the heart towards the midline. After blood cultures are done for endocarditis, what diagnostic study confirms the diagnosis? To validate blood cultures before antibiotics is important as an initial test. After this, TEE, transesophageal echo, confirms diagnosis. Can look closely at the valve. Transthoracic echocardiography is not done for endocarditis. TTE is done to look for left ventricular ejection fraction in the heart failure. So my goal is to do 250 questions. I have already done like 240. I have reached the mark 243. So this is a thickened IVS and a thickened interior wall. Let's see. This is ventricular septal rupture. Note the thin or ruptured area of the IVS in the white arrow. What does pulmonic stenosis sound like when you auscultate it? It is described as mid-systolic murmur or just regular systolic murmur that increases with inspiration at the left sternal border, second intercostal space. This is the theoretical location, whereas aortic stenosis is the second intercostal space on the right, not the left. But USMLE often isn't strict about murmur locations this way. Seen in tetralogy of Fallot, right ventricular hypertrophy, VSD overriding aorta, where the combo of pulmonic stenosis and VSD can lead to the question just saying harsh systolic murmur. We see 56-year-old woman plus painful headache on right side of the head and proximal muscle pain and stiffness. Diagnosis, next best step in the management. Some sort of arteritis maybe. Temporal arteritis, also known as giant cell arteritis. 9 out of 10 questions will be painful, unilateral headache in patient over 50. I have seen one question on NBME where it's bilateral. Flares can be associated with low grade and high ESR. Patients can get proximal muscle pain and stiffness. I swear I don't read like this, but this is how I make it interesting. This is polymyalgia rheumatica. The two do not always go together, but the association is high yield. Do not confuse PMR with polymyositis. The latter will present with increased CK and or proximal muscle weakness or physical exam. PMR won't have either of these findings. I talk about this stuff in detail in my MSK PDF. Patients can get pain with chewing. This is jaw claudication, pain with chew. IST point is we give steroids before biopsy in order to prevent blindness. So yoga, that I knew. An NBME has ischemic optic neuropathy as the answer for what complication we are trying to prevent by giving steroids in temporal arteritis. IV methylprednisolone is typically the steroid given since it is faster than oral prednisone. It is to my observation that it is to the observation of the high care that many NBME questions will give the answer as something like steroids now and then, biopsy within 3 days, or IV methylprednisolone and biopsy within a week. Students ask about the time frames, but for whatever reason, you ultimately give scattered or varied answers like that. Another NBME question gives easy vignette of the temporal arteritis, and the now best step in diagnosis, the answer is biopsy. Steroids aren't part of the answer. Makes sense since they are asking for a diagnostic step. Okay, biopsy or IV methylprednisolone. Easy. What does ASD sound like when you auscultate it? Fixed splitting of ST. I knew. Wide fixed splitting of ST can sometimes be seen, but not always. Wide splitting just means RVH. So wide fixed splitting means right ventricular hypertrophy due to chronic volume overload from an ASD. But once again, not mandatory that RVH occurs. What do the green versus pink arrows refer to? Green versus pink. Pink looks like ischemia and green looks like necrosis. Okay, at 12 to 24 hours, fresh infarcts show dark mottling like those in green arrows. By 10 to 14 days, an infarct becomes a yellow softened area, pink arrow. What does aortic regurgitation sound like when you auscultate it? Decrescendo, hollow diastolic, pan-diastolic murmur can also be described as early diastolic murmur or diastolic murmur, loudest after S2. Okay, early diastolic, decrescendo, loudest at the LMSB. RUSP has root dilation and bleeding by roots. Okay, easy, not easy. What is a paradoxical embolus? ASDs can sometimes be responsible for paradoxical emboli, where a DVT leads too strong. This is ordinarily impossible since a clot embolizing to the lungs where the venous circulation has no way of reaching the arterial circulation. But if an ASD is present, the clot can go to the right atrium. From there, it can go to the left atrium, horizontally, and then to the left ventricle, and then up to the brain, causing stroke. If 99% of MS is due to the history of rheumatic fever, what else can cause it? बता दो भाई. Liebman-Sachs endocarditis in SLE is associated with MS. 60% of those with LS endocarditis have anti-phospholipid antibodies, lupus anticoagulant. How do we manage carotid plaques based on the degree of occlusion? Easy peasy. First, we have to ask whether the patient is symptomatic or asymptomatic. A bruit does not count as symptoms. That's a sign. Research horizon, Valo, please take a break. Symptomatic means stroke, TIA, or renal artery occlusion. According to recent guidelines, carotid occlusion more than 70% if symptomatic or more than 80% if asymptomatic. The answer is 2 carotid end arterectomy. Below these thresholds, the answer is medical management, which is triad of ACE inhibitors or ARBs, statin, antiplatelet therapy. Aspirin alone is sufficient for USMLE. More than 70% is symptomatic or 80% even if asymptomatic to carotid endarterectomy. Below these threshold, we will give ACEs or ARBs, statins, antiplatelet therapy on USMLE. Aspirin alone is sufficient. ECPC. What does a patent foramen ovale sound like when you auscultate it? Fixed splitting of S2. Patent foramen ovale is merely one type of AST, and AST is equal to fixed fixed splitting of S2. Don't confuse PFO with PDA. Patent ductus arteriosus, which is continuous machinery murmur. 2 secure 3 only. If adult over 50 has episodes of unexplained syncope, what is the next best step in diagnosis? Ambulatory ECG monitoring, Holter monitor to look for paroxysmal atrial fibrillation. We want to see if the episodes of syncope coincide with potential AF. What is the mechanism of nitrates used for stable angina? I don't want to think. Nitrates, for example, sublingual isosorbide dinitrate used as treatment. Nitrates donate nitric oxide that upregulates guanylyl cyclase within the venous smooth muscles. Increased cyclic GMP, relaxation of the venous smooth muscles, increased venous pooling of blood, decreased venous return, decreased myocardial oxygen demand, mitigation of chest pain. Nitrates are contraindicated with PDE5 inhibitors, for example, Viagra, due to the risk of low blood pressure. ठीक है, इकट्ठे नहीं देने किसी को. Sodium nitroprusside used for hypertensive emergencies, dilates arterioles. By the way, I don't even know if my voice is being recorded, so this is just me talking to myself. Don't feel important. Sodium nitroprusside is used for hypertensive emergencies and dilates arterioles in addition to the veins. If you are simply asked you where this drug acts, choose arterioles. ECPC. What does MS sound like when you auscultate it? SMECSI. Described as rumbling diastolic murmur. Rumbling. MS, rumbling diastolic murmur with an opening snap. Can also be described as decrescendo mid-late diastolic murmur following the opening snap. But the question need not mention the opening snap, because every time they mention the opening snap, I recognize it as MS, my brother. Easy peasy. 30-year-old man has motor vehicle accident and absent pulses distally in the left leg. What is the most likely diagnosis? जी मामा जी.
इनका होगा तो हम अमेरिका जाएंगे.
बेटा अगर मामा मैच हो जाएंगे तो जाएंगे.
लेकिन अगर मैं 9 का हो जाऊँगा हम जाएंगे अमेरिका.
इंशाल्लाह. बस मेरा बेटा खुश. A 30-year-old man has motor vehicle accident plus absent pulses distally in the left leg. What is the most likely diagnosis and what is the next step in management? मोटर व्हीकल एक्सीडेंट हुआ भाईजान का, पल्सेस एब्सेंट हो गई हैं और डायग्नोसिस क्या है और नेक्स्ट स्टेप क्या है. If question gives you MBA where the knee is injured and the pulses are absent distally, the sequence of answer they want is knee relocation first, followed by arteriography to look for popliteal artery injury. In one of the two CK questions, they already tell you the knee is relocated. That's why they call you the Mahalman, you man. Then the answer is arteriography with runoff, and that's why nerds hate you, Mahalman, because you make idiots like us answer like nerds. In one of the two CK questions, they already tell you the knee is relocated. Then the answer is arteriography with runoff. Student says, what the fuck is the runoff part? Doesn't matter. It's just what they want. Chup karke answer lao. What is the treatment for pericarditis? Ibuprofen? Yeah. Treatment for pericarditis is same as acute gout. NSAIDs, colchicine, and steroids. Easy. How do we treat VT? VT is treated with arrhythmics, that is amiodarone. If patient has coma or hemodynamic, अगर किसी की अम्मी ड्रॉनी होंगी तो उसको बेचारे को वीटी तो होगा ना. तो वेंट्रिकुलर टैकीकार्डिया में क्या देते हैं ज़ारा बेटे, क्या देते हैं? Amiodarone. If the patient has coma or hemodynamic instability, low BP, the NBME answer is direct current counter shock or cardioversion. Same thing. VT is treated with antiarrhythmics, that is amiodarone. If the patient has coma or hemodynamic instability, low BP, the NBME answer is direct current counter shock or cardioversion, which is basically the same thing. What is the highest yield cause of aortic regurg on listen? Aortic dissection. ये बात मैं उर्दू में बोलूँगी अगर कभी वो बेचारा क्रीप ना होता तो ना मैं इतनी बड़ी उसकी फ़ैन हूँ कि शायद मैं नहीं रहने दूँ. अल्लाह का मार कॉल हुआ. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. What is the highest yield cause of aortic regurg on USMLE? Aortic dissection. It can retrograde propagate. क्या बात है? Retrograde propagate toward the कौन कहते हैं मेडिसिन में शायरी में? Retrograde propagate toward the aortic root, causing aortic root dilatation and AR. Even though MVP is most common in Marfan and Ehlers-Danlos, AR is second most common in these patients. MVP most common है? मैं तो समझती थी AR सबसे ज़्यादा common है, but they are saying AR is second most common in these patients, since if they get aortic dissection, this can lead to AR. Jazakallah bhaijan. Easy. Creamy plasma on lab inspection. Familial hyperchylomicronemia. Understandable. I'm sorry. Easy. What's the cause of death in her coma? Ventricular fibrillation due to acute left heart strain. The sudden death in young athlete is not due to an MI, that is the patient has clean coronary arteries. Do not select coronary artery occlusion as the answer. Got it? What causes AV fistula? If a patient has AVF, what cardiovascular problem can this lead to? What does AVF sound like if auscultated? Bhaijan, why are you attacking me? I don't know. Okay, Bhaijan is done. Can be idiopathic iatrogenic, that is dialysis, from injury, that is stab wound, or caused by AVF था क्या? अच्छा, arteriovenous fistula. Or caused by other diseases, that is hereditary hemorrhagic telangiectasia or Paget disease of bone. Similar to aortic aneurysms, AV fistula can sometimes present with pulsatile mass, but in a weird location, for example around the left ear in a patient with tinnitus. On NBME exam, भाईजान मैं नहीं कह रहा, NBME कहते हैं. In a weird location, for example around the left ear in a patient with tinnitus. Pulsatile mass हो सकता है ये. Students say what is at the left ear though? No fucking idea. Take it up with the NBME. And then I'll juggle out. Highest seal point is they can cause high output cardiac failure. This is because blood quickly enters the venous circulation from the arterial circulation. Combo of increased preload back to right heart plus poorer arterial perfusion distal to the fistula leads to compensatory increased CO, cardiac output. AV fistula can sometimes present with a continuous machinery murmur, which is similar to a PDA since blood is continuously flowing through it. They might say a continuous machinery like murmur is. ऐसे पढ़ने में तुम जी याद कैसे रहेगा? AV fistula can sometimes present with a continuous machinery murmur similar to a PDA since the blood is continuously flowing through it. They might say a continuous machinery-like murmur is auscultated in the leg at the site of prior stab wound. Easy. Comment on peripheral edema in pregnancy. A little bit of peripheral edema is normal in pregnancy due to compression of the IVC. If patient has more severe additional findings like dyspnea and JVD, think peripartum cardiomyopathy. Easy. What is orthopnea? Orthonia? I don't know. Shortness of breath. Reflective of LH decompensation. Requirement to sleep on multiple pillows when supine to prevent fluid buildup in lungs. When supine, there is greater venous return, greater preload, worsening of dyspnea because the heart cannot handle the volume. That is, it decompensates because greater oxygen demand by the LV with greater preload. Lipids couriers have a limited message to me. Okay, gee. In dilated cardiomyopathy, are we most likely to hear an S3 or S4 heart sound if we have to choose one? I think I'll choose S4, static लगता है. नहीं statics ने कभी बचाया किसी को? नहीं. S3 since this means systolic dysfunction 14 out of 15 times. यह याद रखना. S3 का मतलब होता है systolic dysfunction. S3 volume overload in the left ventricle, as I talk about in other cards. S3 can also be physiological, such as in pregnancy or in high endurance athletes. There is question in CMS IM form 7 2 leak कर दे भाई. For 2CK where they give S3 in diastolic dysfunction patient, it's an erratum. I am who? No, I'm not who. I'm just letting you know the question exists. Otherwise, some student in the future is going to trip out and DM me over it. What is cor pulmonale? Right heart failure. Due to a pulmonary cause, that is COPD, CF, pulmonary fibrosis, etc., etc., etc. Easy. Diagnosis. Dissociation between the P wave and the QRS complexes? Probably. Irregular rhythm with ebbs and P waves. Notice how the QRS complexes are random and irregular distances from one another. This is the irregular pattern. Atrial fibrillation is easy. What is parasternal heave? सीने के पार पैदा है. Means the heartbeat can be felt or sometimes seen along the left sternal border, usually due to right ventricular hypertrophy. Since the RV is most anterior, RVH can be seen in ventricular septal defect. So parasternal heave can be seen in VST. What is congestive heart failure? CHF. Right heart failure plus left heart failure. Or a stroke-like presentation in a patient who had MI weeks ago, embolized from the ventricular septal aneurysm. What does tricuspid regurgitation sound like when you auscultate it? Follows systolic murmur that increases with inspiration. Right-sided heart murmur get worse with inspiration. Diaphragm moves down. Decreased intrathoracic pressure, increased right heart filling. TR can also cause pulsatile lever. What is a palpable thrill? A palpable thrill. इसको पता है कि मेरी कार्डियो वीक है जो कार्डियो कराई जा रहा है मुझे. A palpable thrill is merely a palpable murmur. It carries no additional diagnostic significance. A thrill is seen in grades 4 to 6 of the heart sounds. ठीक है भाई. Why does expiration intensify left-sided murmurs? Expiration increases intrathoracic pressure, which decreases the pulmonary vascular compliance. Transient increase in मतलब बंदा गल सिद्धि भी कर लेंदा है. Decreased pulmonary vascular compliance. So ही समझ आती है बात. तो उससे there would be a transient increase in pulmonary venous return to the left atrium. समझ आ गई बात. Increased left atrium preload हो जाएगा It should be noted that although right atrium preload decreases, this effect does not carry over to the left atrium because of the pulmonary vascular compression. ਕੱਖ ਪੱਲੇ ਨਹੀਂ ਪਿਆ. Expiration causes increased intrathoracic pressure. Decreased pulmonary vascular compliance, transient increase in pulmonary venous return to the left atrium, increased left atrium preload. It should be noted that although RA preload decreases, this effect does not carry over to the LA because of the pulmonary vascular compression. How does aortic dissection present? Jones classically presents as severe upper chest pain radiating to the back between the scapulae. Patient can have blood pressure that is different between the arms. शुक्र है तुमने तो डरा दिया था. मैं डराती रहती हूँ अपने रिश्तेदारों को, बहन भाइयों को. Classically presents as severe upper chest pain radiating to the back between the scapulae. Patient can have blood pressure that is different. बहुत भूख लग गई, नाश्ता करना है. Can have blood pressure that is different between the arms. हाँ, ये तो बहुत आता है. Yosemite loves this as most common cause of aortic regurgitation due to retrograde propagation toward the aortic root. For example, patient with history of hypertension, cocaine-use, or a connective tissue disorder that is Marfan Ehlers-Danlos who has a diastolic murmur, you should be thinking immediately that this is dissection even if the patient doesn't have a verb. Pain that's worse when lying back, better than leaning forward. In turn, the patient can present walking through the door bent over at the waist. Patient will have a pain that's worse when lying back, better when leaning forward. In turn, the patient can present walking through the door bent over the waist. Wide complex tachycardia diagnosis is VT. VT has wide complexes. SVT has narrow complexes. Easy. How does the antiphospholipid syndrome present? DVTs despite paradoxical increase in PTT. In other words, if PTT is high, you think you have bleeding diathesis, not thrombosis. This is because antibodies against phospholipids cause in vivo clumping of the platelets and increased risk for clot initiation, but disruption of in vitro PTT assay which requires phospholipid means high PTT. The antibodies are known to target anti-beta-2 microglobulin or anti-cardiolipin. The patient may have SLE, high yield cause of antiphospholipid syndrome. If patient does have SLE, we call these same anticoagulant antibodies lupus anticoagulant. What does paradoxical splitting of S2 mean? It means left ventricular hypertrophy in USMLE. A2 occurs after P2. Normally we have A2 then P2. Left ventricular pressure is high and A2 is delayed to the point that it actually occurs on the opposite side of P2. Paradoxical splitting of S2, left axis deviation on ECG and left bundle branch block all is equal to left ventricular hypertrophy on USMLE. I just want to do 12 cards more ताकि 50 तो होएं. In contrast, right splitting of S2, right axis deviation on ECG and right bundle branch block all is equal to right ventricular hypertrophy in USMLE. Easy peasy. ਵੱਡਾ ਦਿਲ, ਵੱਡੇ ਲੋਕ ਤੇ ਵੱਡਾ ਦਿਲ, boot shaped heart. It's dilated cardiomyopathy can be isolated ventricular or diffuse fourth chamber dilatation. Causes are multifarious, but a key feature is systolic dysfunction. मेलमैन पाई जाती अंग्रेज़ी बहुत चंगी है क्योंकि उन्होंने लिखा है causes are multifarious. Multiple भी कह सकते सन, लेकिन इंज पता नहीं सी लगना. But a key feature is systolic dysfunction where ejection fraction is reduced, that is less than 55%, where the normal range is 55 to 70%. Chest X-ray shows enlarged cardiac silhouette. Easy peasy. What is normal ejection fraction? 55 to 70%. What is the first step in the diagnosis for arterial disease? If the SAM already tells you this first step was done, what does USMLE want next? Ankle brachial indices are first step in diagnosis, exceedingly high yield on 2CK, which compare blood pressure in the ankle to the arm. If less than 0.9, this reflects decreased peripheral blood flow due to atherosclerosis. If ankle brachial indices are not listed as first step in diagnosis for whatever reason, choose Doppler ultrasound. There is one 2CK NBME question where this is the case. After ABIs, next step is to exercise stress test if listed. ये question मुझे आया था. ABIs next step is exercise stress test if listed in order to determine exercise tolerance. If not listed, go straight to recommend an exercise or walking program. Do not choose cilostazol first or arteriography as answer. I always choose cilostazol first and arteriography as my answers. So thank you Mimi Bai for saving. Why did I call him Mimi? What is a classic triad of medications patients with peripheral vascular disease would be on? All patients with arterial disease should be on a triad of ACEs and ARBs, statin, antiplatelet therapy, same as carotid stenosis. Hypokinesis of the apex of the heart on echo. Which vessel is affected? LAD, which supplies the apex. Simple. What is the first degree heart block? PR interval more than 200 milliseconds. 25 male, cystic fibrosis है, JVD है, peripheral edema है, crackles in the lung. Diagnosis is core pulmonary. Crackles are due to CF, not LH failure. Okay. It's not due to cystic fibrosis, I think. What is hypertrophic cardiomyopathy? It is a heart failure due to systemic hypertension. Don't confuse with hypertrophic obstructive cardiomyopathy, which is an autosomal dominant condition with sudden death in young athletes. HUCM, in contrast, is just HCM is just from hypertension. What are the four more components of tetralogy of Fallot? PROV, PROV. Pulmonic stenosis, right ventricular hypertrophy. O is for overriding aorta and V is for VST. If you are asked which component most determines the prognosis, the answer is the degree of pulmonic stenosis. Mummy ji. 47 female has varicose veins and painful palpable cord by the ankle. Diagnosis is superficial thrombophlebitis. ये भी क्वेश्चन आता है. Subcutaneous enoxaparin. Heparin is the answer USMLE wants. Compression stocking and warm compressors are wrong when listed together, and I would always select those. Subcutaneous enoxaparin. Child plus idiopathic arrhythmia disorder, seizure-like episode, disease is Adams-Stokes attack, which is asked on the PED, CMS or NBME form, even if you find this menacing, low yield or inconvenient. Not a true seizure if EEG performed. Arrhythmia causes hypoxia of the brainstem. Seizure-like fit ensues. What is the pelvic septic thrombophlebitis? This is particularly high yield on 2CK OB-GYN forms. The answer on USMLE in a woman who has postpartum endometritis, fever plus tender lower abdomen. आखिरी सवाल रह गया था तो कंस्ट्रक्शन वालों ने कंस्ट्रक्शन शुरू कर दिया. Who has postpartum endometritis, fever plus tender lower abdomen with persistent fever more than 48 hours despite antibiotics. Endometritis can lead to increased risk of local infective clots in the ovarian veins. If they give you a postpartum woman with sepsis, that is SARS plus infection, but the winner doesn't fit PST as described above, the answer is puerperal sepsis on the OB-GYN form. The latter is more a general term and can refer to many causes of postpartum sepsis, including PST, confusingly enough. Pelvic septic thrombophlebitis, more than 48 hours despite antibiotics. Easy. 30-year-old woman plus history of recurrent duodenal ulcer, had a calcium kidney stone a year ago. The diagnosis is men 1, parathyroid adenoma or hyperplasia, pituitary adenoma, pancreatic adenoma. Zollinger-Ellison syndrome, gastrinoma is highest yield pancreatic tumor in men 1, will present as recurrent peptic ulcers. I discussed this stuff in detail in the high yield gastro PDF. Parathyroid adenoma often presents with calcium urolithiasis, where they will mention flank or groin pain in a patient with history of ulcers. Zollinger-Ellison prolactinoma is the highest yield pituitary tumor. Your summary need not give the full constellation of finding for the men syndromes. Here is an NVME question floating around where the patient has a parathyroid adenoma, nothing more, and the answer is just MEN1 as the gene that's mutated. Easy. It is cyanotic at birth. Before surgery, what medication should be given? Prostaglandin. An open PDA can mask and or mitigate the effects of cyanotic congenital heart disease. Prostaglandin keeps the PDA open. Most common cause of carotid plaques is hypertension. The strong systolic impulse from the heart pounds the carotid endothelial damage. Atherosclerosis. Easy. Explain the splitting of S2. The aortic valve normally shuts A2 just before the pulmonic valve P2, so A2 will occur slightly before P2. When we talk about changes in the splitting of the S2 heart sounds, that is wide splitting, paradoxical splitting, etc. If the pressure in a ventricle is greater, the sound will occur later or is protracted. So if the right ventricular pressure becomes greater for whatever reason, P2 occurs later. Wider splitting. So pulmonary artery hypertension और right ventricular hypertrophy दोनों का answer would be wide splitting. If LV pressure becomes greater, left side पे pressure ज़्यादा होगा तो A2 occurs later and can even occur after P2. This is paradoxical splitting. So LVH is equal to paradoxical splitting. When right or left ventricular pressure exceeds the pulmonic arterial and aortic pressure respectively, the valves open. Then the ventricle will lose pressure as the blood ejects, followed by isovolumetric relaxation, marking the onset of diastole, and the pressure within the ventricle falls below the pressure distal to the valve and the valve shuts. Normal splitting oscillates with the respiratory cycle. Inhalation causes P2 to occur later. ये मुझे कुछ समझ नहीं आ रहा. Decrease in intrathoracic pressure, increased venous return to the right atrium, more blood in the right ventricle, more preload, more pressure, increased time it takes for RV pressure to fall below the pulmonic arterial pressure is greater. P2 will occur slightly later with inhalation. With exhalation, it's the opposite. P2 occurs slightly sooner because increased intrathoracic pressure. ये कोई 10वीं दफ़ा मुझे मैसेज आया, शुक्र है तुमने डरा दिया था. P2 occurs slightly sooner because increased intrathoracic pressure will attenuate the venous return, less preload in right ventricle, less pressure in right ventricle. Time it takes for RV pressure to fall between pulmonic arterial pressure is less, so pulmonic valve closes slightly sooner and distance between A2 and P2 is less. भाई ये हार्ड था, जो सच्ची बात है. 65 male plus 2 to 3 day history of severe chest pain. उन्होंने अगेन कर दिया, वो फिर आ जाएगा. और प्लस dyspnea plus visible pulsation above the menobrium and tracheal deviation plus murmur in second intercostal space on the right aortic. ठीक है बेटा. Aortic aneurysm, visible pulsation is buzzy for aneurysm.